All right. One second. I'll make sure that I'm sharing my screen. Okay. Well, welcome everyone. Thank you for joining me today. We're going to talk about this really cool intervention that we offer at Juno Counseling and Wellness called the Safe and Sound Protocol, or we refer to it as the SSP sometimes. It is a really cool approach to regulating our nervous system in a safe, non-invasive way that can actually be really enjoyable, relaxing, even fun sometimes. So I'm just going to start out by telling you a little bit about myself and about the practice, and then I'll jump right in and kind of give you some information about the SSP and how we use it for kids, adults, couples, families, and teens. So let's jump in. So if you don't know me, my name is Dr. Vasilia Binnenstock. I am the founder of Juno Counseling and Wellness, which I'll talk about our practice in a minute. We are a group practice and we see people ages 2 and up, basically. Um, I've been an invited speaker and trainer on trauma, mental health for corporations, mental health for students, and wellness in general. I've spoken in different places around this county, Palm Beach County, and around the country as well. I have written several academic texts and journal articles. So I've written some textbooks about assessing risk in cases with child maltreatment, about utilizing cognitive behavioral therapy for medical interventions, and other therapeutic related topics. I've developed um, therapy tools and journals for clinicians and clients. Some of my journals can be found on Amazon. So I've got a cool series called Track and Transform. And these are journals that can help you track your progress in different types of therapy or track things like anxiety and panic and their triggers. And I have been interviewed in a lot of major media outlets and done a lot of professional conferences. I used to teach. I taught for about 10 years. I taught psychology at Palm Beach State College, as well as human services, and I taught counseling in some graduate programs like Northwestern University, Florida Atlantic University. And I'm also a qualified supervisor for counseling interns that have graduated and are seeking licensure. So this is my practice, Juno Counseling and Wellness. We did start out in Juno Beach, and I just kept that name. But we are actually located in Palm Beach Gardens. We offer in-person and telehealth. So if you come see us in person, we're just right off of PGA Boulevard in Palm Beach Gardens. We offer a trauma-informed, holistic mental health care approach. We offer psychotherapy for children ages 2 and up. We have play therapy, a sensory room. The picture you're looking at here is actually in our sensory room. It's a room that we keep dark and use these kind of really cool fiber optic features and tactile features and things that kind of help kids and teens primarily calm down and calm some sensory overload if that's what they're dealing with. Um, and we also see teens, adults, individually, couples, and families. For couples, we utilize Gottman method and emotionally focused couples therapy. We do have some special things like the SSP. We're bringing in something called Brain Tap, which is a tool that uses what we call brain entrainment. So using light and sound in order to sync up our brain waves and get our brains healthier and working the way that they're supposed to. And we also have two nutritionists, one for adults, one pediatric, and they are specifically focused on nutrition for supporting mental health. So we try to provide this very compassionate trauma-informed model that blends psychotherapy with these other innovative techniques. Sometimes I call it like psychotherapy meets biohacking. So we offer the one-to-one therapy, and we're now starting to offer some really more immersive therapeutic programs, which are a little more intensive. Um, and those are for somewhat harder to treat issues like some psychosomatic disorders or for really persistent anxiety or depression. So you can check out our website to find out more about us. So, diving right in, what is the Safe and Sound Protocol? It is developed by Dr. Stephen Porges, based in polyvagal theory. So, polyvagal theory focuses on how our nervous system affects how we feel and how our nervous system can be encoded with certain information that can then arise into symptoms that we see as psychological symptoms. For example, if you ever had a time in your life where something was really scary and you had to bottle that up and you couldn't allow yourself to process it and you couldn't allow your body to do what it naturally does, like one of those things is shaking or retreating or curling up, then that information can sort of get stored in your brain and in your body in such a way that it later on leads to dysregulation, which can lead to symptoms like anxiety and trauma-based symptoms. So, the Safe and Sound protocol is non-invasive, an auditory intervention designed to calm the nervous system. So what that is it's actually just listening to music. That's all that the client really has to do. The music is specially filtered. It's a special program that we license from a company called Unite, which owns the entire license to the Safe and Sound protocol. And so the specially filtered music stimulates your vagus nerve, which is a nerve that runs basically from the top of your head all the way down along your spinal cord and controls and helps regulate a lot of different bodily processes. And so this specially filtered music stimulates the vagus nerve and helps our bodies get out of fight or flight or freeze. You might have heard of fight or flight responses. Freeze is something we do when we totally shut down. Freeze in regular life might look like depression or a total lack of motivation. And for some people, even like a collapse and symptoms like fainting, things like that. So, it helps individuals feel safer, more connected, and better able to engage with the world. What it really does is stretch your nervous system and also your social capacity in your nervous system, your capacity to be around other people and still feel safe and grounded, right? Because sometimes it's a little easier to be on our own than it feels to be with others. And your body knows the difference. And that's why a lot of people have social anxiety only. It's something about being around other people that brings on these symptoms. So, how does the SSP work? The music is filtered to emphasize frequencies of human speech, particularly a certain cadence that is comforting in our voices. So, believe it or not, it's pretty cool. We've evolved to this point where, say, a mother talking to her infant, there is a certain tone and cadence to that speech that communicates to the infant on an unconscious level that the infant is safe. Because that's really our first question when we're born into the world, right? We don't know anything. The first few days, we can barely even see in front of us. We need to understand that we're safe. And so much of that is communicated in an unconscious way. It's communicated through touch, it's communicated through getting our needs met, fed when we need to be fed, changed when we need to be changed, and also through that kind of talk and communication. So the SSP actually mimics that. You can really find that sort of tone in other things in nature. So actually, the rustling of leaves has shown a similar vibrational tone to that, and that's why one of the reasons nature can help calm us down so much. So we deliver this through headphones. Basically, you put on headphones and you listen to the SSP. It's 5 hours long. You don't listen to all 5 hours at once. You listen in really brief increments, and that depends on the person. So some people can handle half an hour at a time, some really 15 minutes at a time, and some people feel like it's just really a stretch for them to get there. And so we cut that down to sometimes even about 3 to 5 minutes at a time on just kind of a regular, consistent basis. So we tailor that to you based on your own presentation, your own nervous system, and then how you start to respond to the SSP. Um, so the best way to do it is to have some social involvement, meaning just having another person in the room. it's best to start at least the first few hours doing with the therapist. What that might look like is coming in for your regular therapy session and using the first 15 minutes of it to do just some SSP listening. Your therapist might actually listen with you. We've all gone through it ourselves, or they might just do some activity. You might be offered an activity like a coloring or a puzzle, or you can just kind of chill out and lay down. Either way. Um, so not only does this help regulate us in the fight, flight, freeze response, but it actually enhances our neuroplasticity, which is our brain's ability to change, to grow, to form new good connections, and overall our emotional resilience. So we've actually have a lot of kids using the SSP. You know, when we started it, I started by bringing it in to adults, and surprisingly, most of our first clients turned out to be kids. Um, so with kids, they just express their emotions in different ways, and when they become emotionally dysregulated, they often don't tell you, that I'm upset. They don't have the words, they don't have the emotional language. And so what you might see is like acting out, or you might see internalization. You might see them pick at their skin. You might see that they wet their bed or wet their pants well past the age when it's kind of typical to do that kind of thing. Or they might even get aggressive or push down another kid or hit a teacher or do something like that. Basically, have a meltdown. And so with our kids, we use play therapy, sand tray therapy, but we found that the SSP is this really great base foundation for regulating that nervous system and actually really allowing them to engage in the therapy even more. So whether it's kids or adults, the one thing that we found is that the SSP cuts down on the amount of time people have to spend in therapy in order to see results. Now, that doesn't mean that it's going to be an overnight success, but it does mean I've seen clients where they've been able to make such great strides. And just from all of the experience that I have doing this, I can tell that they've saved sometimes up to 2 years of work of getting through some of those emotional barriers, and getting regulated enough for the other work that we do to actually be effective. So that's like one of the coolest things about it is just the amount of time that it cuts off of the actual therapy time. Um, so for kids, it can help reduce meltdowns, reduce anxiety, and reduce emotional dysregulation. Supports children with ADHD, autism, sensory processing disorders, and trauma. So a lot of kids who actually have a hard time with sensory things, with lights, with sounds, with textures, and things like that, this can actually train their nervous system to be a little more tolerant of those kinds of stimuli. It also enhances connection and communication. And as I said, it can be paired with play therapy, and other modalities. And that is what's giving us really the best outcomes here with kids. So, uses for adults, it helps calm chronic anxiety and stress. And like I said, it really helps us do the other therapeutic work. So you might have heard of something like CBT or DBT, cognitive behavioral therapy or dialectical behavior therapy, or you may have heard of EMDR, eye movement reprocessing and desensitization therapy, which uses eye movement or hand stimulation in order to process difficult or traumatic memories. For somebody who is constantly in a fight or flight state, they're constantly at a 10 out of 10 on feeling stressed out. They really have a hard time calming down. They very easily slip into anxiety or kind of collapse into total low motivation. They might learn some of these tools. So, the cognitive behavioral therapy, we might teach you that your thoughts affect your emotions and affect your behavior, and how to change your thoughts in a healthier way, how to add in new behaviors that help with some of these anxiety or depression or trauma symptoms. But if you're completely dysregulated, you might find that it's really hard to implement that. It feels like a real chore. You're always forgetting, or if you do make some progress, it's really easy to get triggered and slip right back to where you were before. And so we find that if you start out with the SSP earlier on in the therapy, people are better able to engage in those other therapies, especially things like pairing it with EMDR. That if your nervous system comes in feeling traumatized and unsafe, and we try to do EMDR, that's not necessarily a bad thing, but it can take a long time. It can take a long time to get to the root of the problem. It can take a long time to process everything out and to feel more stabilized. But if we can use this tool to basically tell your nervous system that you are safe, you're safe with me, the therapist, you're safe in your body, then your body, your brain is going to respond that much better to something like EMDR. Or you're going to find that it's easier to get motivated to apply some of the coping skills and other tools like that. Or you'll find that you have more capacity inherently to handle stress. And so smaller stressors no longer send you into fight or flight or panic mode or feeling totally overwhelmed. You'd be like, wow, I have this capacity. Normally, that would have made me so overwhelmed, and maybe I would have coped in a bad way. And now I feel like I'm okay with it. I may not like the stressor, but I can handle it more. And if we can get you to that point, then we add on the other therapeutic approaches, then we're really doing well for you. Um, so the SSP also supports trauma recovery, emotional resilience. It can help with sleep, focus, emotional regulation. Like I said, breaks those patterns of shutdown, irritability, or reactivity. Um, so overall, we not only use just there's three SSP tracks. One is one that just kind of gets you acclimated to it. It has no filtration. Then there's something we call SSP core. That is the therapeutic piece. And we then give you, once you complete that, we give you access to something called balance. So all of these gains that you're making here while doing the SSP, you can continue and keep them up by listening to the balance tracks as needed. And we give you access to that for several months after you're done with the program. So, what happens if you go to therapy or you send your kids to therapy and they are getting better and then they're coming home to an environment where other people are dysregulated? So, you get better and then your partner, they still maybe are dysregulated. They're no longer meeting you where you are. That's a really tough thing. I mean, I've seen a lot of people who come and work on themselves and they get to a really good place and then all of a sudden they have problems in their relationship because they've been moving ahead and their partner is not following along. And that's not the end of the world, but it would be a lot better if you can get your partner to follow along. It would be a lot better if we treat the children and the parents also use SSP and they learn about themselves. They're in a more regulated state. They're able to regulate their children even better that way. And like I said, this is a social process. So it enhances that co-regulation and communication, helps family members feel more connected, safer around each other, reduces reactivity in conflict situations. So you're never going to avoid conflict. But the point is, how do you respond to it? How do you react to it? So if we are, like I said in the last bit, having more capacity for stressors, we have more capacity for conflict. So say you take a couple that hasn't handled conflict well, and you use something like the SSP to help stretch their nervous system, stretch their ability to handle conflict, to tolerate more, then both of those individuals are, it's going to take a lot more to trigger them to the point where they can't hear each other anymore, or they're yelling, or they're responding in unhealthy ways. So, just in that, in and of itself, is going to allow couples to actually be able to stay calm, communicate, and stay connected to each other rather than retreating within or disconnecting or shutting down like many people do. And they do that because they don't feel safe in the situation. And it's not even a choice. It's something that happens automatically within us. And that's when you're seeing that fight, flight, or freeze. So overall, strengthens relationships by supporting nervous system attunement. And we do have actually a special pricing plan for couples and families where, the initial person pays our full fee, and then it's a much, much smaller fee for each additional person. And that can make it a lot easier to get everybody on board and everybody using the SSP. So I've talked a little bit about this, how you listen to filtered music through headphones for 5 total hours. The sessions are broken up into short, more manageable increments, can be done in a calm, safe environment. Now, a lot of people ask, can I find this somewhere and just do it on my own? The truth is, it really needs to be facilitated by a trained SSP provider because we're not just trained in making you listen to music. You were trained in understanding the somatics. We're trained in recognizing when somebody's becoming dysregulated. We're trained in helping them get to where they need to be. There's something called the window of tolerance. So your ability to tolerate stressful events. Now, big traumas, they're always going to be outside of our window of tolerance. That's what makes them traumas. But mild to moderate stressors, ideally, should be in our window of tolerance. Now, if we pop out of our window of tolerance to the top, that's where we get fight or flight. We can't take it anymore. We're in overdrive. We either want to run away or shut down, or become argumentative, or just be angry or have road rage or something like that. When we pop down out of our window of tolerance, that's when we're getting to freeze and shut down mode. We withdraw, go within, feel unmotivated, feel like we can't find the words for something. And what we want to do is be in that window of tolerance as much as possible. Now, for some people, that window is like really, really, really narrow. And that means even small to medium stressors are forcing that person out of their window of tolerance and putting them into fight or flight or freeze or shut down. And we use things like the SSP and general somatic experiencing techniques together in order to help you stretch that window of tolerance and give you a much bigger window of tolerance. So that means that the daily things that maybe would have riled you before are not hitting you in the same way, which is really, really pretty cool. And then once you can tolerate that, so imagine if you have trauma that you want to process. Imagine if you have social anxiety and you're constantly being bombarded with triggers and your window of tolerance is really small, and we're telling you, oh, here are all the things you need to change or you need to process your trauma. It's going to be really, really challenging. But if we can expand that window of tolerance, you'll also be able to not only handle day-to-day things better, but actually handle the therapy better, which is pretty cool. So you should definitely contact us if you're interested. We can give you a lot more information on our website. We have a page about SSP, and the page has info, videos that link to the Unite platform, the people who carry the SSP who will tell you more about it. You can give us a call or you can send me an email directly and I can tell you more about it. We do offer different pricing plans for this. We really prefer for somebody to be in therapy to do this because you need to have that safety. You need to have that baseline. If you're not in therapy, or if you are in therapy, but in a different practice than ours, that can be okay. But we need to build in a little extra face-to-face time with you in order to deliver the SSP, typically about 3 hours total of face-to-face time. Now, that can be in person, which is preferable, but it can also be virtual. But it has to be virtual, kind of live like this. It can't be over the phone or with the camera off or things like that. Um, and we do actually offer financing through certain third-party financiers through Stripe. So that can be a really great affordable option, a way to invest in really what is your long-term mental health care. All right, so I'm just going to go ahead and stop sharing. I hope that you have enjoyed this presentation and that it's been illuminating for you, whether it's about the SSP or nervous system dysregulation or any of these concepts in general. And like I said, if you have any other questions or you're just interested for yourself or someone else, just feel free to reach out to us. Thank you.